One of the main tasks of the state is comprehensive care for the health, physical education and development of students. The young generation is the closest reproductive, intellectual, economic, military, social and cultural reserve of the country. In the city of Astana, medical support for students is provided by the City Polyclinic 3. The polyclinic also provides primary health care, consultative and diagnostic, specialized medical and hospital replacing care to the assigned population.
Наша поликлиника исторически сложилась, что она была организована с 1974 года, то есть ее история более 40 лет, то есть во времен Целинограда образовалась данная организация и называлась студенческая поликлиника.
The attached population is 50,439 people, including 40,867 adults, 5,355 adolescents and 4,217 children. The peculiarity of the service polyclinic is that more than 70% of the attached population are students of higher educational institutions and secondary educational institutions. The radius of service clinics 40 kilometers. The planned capacity of the clinic 251 visits per shift. The main principles of the clinic: providing the served population with guaranteed free medical care, the principle of the absolute availability of timely, high-quality, continuous, safe medical care, patient satisfaction with medical care, high professional level in the provision of medical care. The organizational structure of the polyclinic: the Department of Prevention and Socio-Psychological Aid, the Youth Health Center, Jazz Tolkien, 6 sections of general practitioners, 12 therapeutic areas, a specialized clinical and diagnostic department, medical military call-up commissions of the Department of Defense Affairs of Astana.
Уважаемые мамочки, сегодня у нас первый день, первое занятие в школе для подготовки беременных к родам. И темой нашего сегодняшнего занятия будет «Жизнь до рождения. Физиология беременности».
106 doctors provide medical care to the population. Categorization among doctors amounts to 48.1%, as well as 161 secondary medical workers, of whom 34% have the qualification category. In the clinic, consultative and diagnostic assistance to adults and children is provided in 22 specialties, and the following diagnostic examination methods are carried out: laboratory, X-ray, functional, ultrasound, endoscopic. The clinic has a digital radiography apparatus, digital fluorography, video endoscopic system, video gastroscope, gastrofibroendoscope, defibrillator, computer multi-channel electroencephalograph, ultrasound diagnostic scanners, eye lamp for ophthalmoscopy of the eyes, hematology analyzer, urine analyzer, physical equipment, ECG devices, ECG apparatus, ultrasound apparatus, eye analyzer, hematology analyzer, urine analyzer, physiotherapy equipment, ECG apparatus, ultrasound apparatus, eye examinations, digital fluorographic mobile cabinet and so on. As part of the national program, annual screening surveys among the adult population continue, aimed at preventing, early detection and prevention of major diseases of the circulatory system, diabetes mellitus, glaucoma, as well as early detection of pre-tumor and malignant neoplasms.
Говорить это ежедневно, ежеминутно, потому что наше настроение действительно зависит от нас. Скажите, уважаемые коллеги, понравился ли вам тренинг? Что вам этот тренинг дал? Давайте поделимся своими впечатлениями.
По этому тренингу я поняла, что в жизни самое главное – это твое состояние, то есть духовное состояние каждого человека. И, конечно же, психическое здоровье каждого человека. Все зависит от нас самих, и всегда мы должны стремиться к лучшему и мы должны всегда радоваться, быть счастливыми и идти только вперед.
Бұл тренинг маған өте қатты ұнады. Себебі бұл тренингте біздің алған нәрселеріміз өте көп болды. Сіздер бізге үлкен сенімділік, алға деген үміт бердіңіздер. Психологтарды жалпы өзім қатты жақсы көремін, себебі менің анам психолог. Сол себепті мен бұл мамандықты өте қатты сыйлаймын. Сіздерге үлкен рахмет.
In addition, prophylactic medical examinations of children and adolescents are held annually, aimed at preventing, prior detection and prevention of diseases that are associated with the characteristics of anatomical and physiological development at different age periods of life. For a complex of treatment and prophylactic measures for dispensary patients, people with risk factors, people with disabilities, a condition that does not require round-the-clock monitoring, a day hospital operates at the clinic. For the implementation of the planned hospitalization of patients in the clinic, the rhythmic work of the portal of the Hospitalization Bureau, ensuring the patient's free choice of medical organization, has been established. In order to improve the quality of medical services, reduce complaints of the population, as well as to solve issues on a here and now principle, the patient support and internal control audit service works in the clinic. A distinctive feature of the City Polyclinic 3 from other polyclinics is that the Medical Commission on registration of pre-conscripts to the recruiting stations and the call for urgent military service in the armed forces of the Republic of Kazakhstan is centrally conducted by the doctors of the polyclinic, as well as to strengthen and preserve health, creating a healthy image. There is a youth health center, Jazz Tolkien, among young people at the polyclinic. The priority directions of activity of the state municipal enterprise on the right of economic management, City Polyclinic 3, of the Akimat of Astana City are: implementation of the state program for the development of healthcare in the Republic of Kazakhstan, Densolek, for 2016-2019, to continue the preparatory measures for the introduction of compulsory social health insurance, as well as further conducting outreach to the population and the staff of the polyclinic, further stabilization and improvement of indicators of maternal, infant mortality, as well as incidence rates of major socially significant diseases and mortality from these causes, further improvement of the qualifications of doctors and secondary medical